All right, so my name is Dr. Mavis Kwabla, and I'm a senior lecturer at the University of Health and Allied Sciences, the Fred Newton Binker School of Public Health in the Department of Epidemiology and Biostatistics. This afternoon, we are talking about root cause analysis and the role of public health officers. So all about root cause analysis, how this is done, with examples of how this is applied in public health. By way of learning outcomes, this training session will help participants understand the concept of root cause analysis, identify tools and methods that are used in root cause analysis, recognize the role of public health officers in conducting root cause analysis, and then apply root cause analysis principles in public health. So we'll take a few examples of how this is applied in public health. So what is root cause analysis? So anywhere you see RCA, it's referring to root cause analysis. It is a systematic process for identifying underlying causes of adverse events. So if there is an adverse event, any negative event that happens after we've given service, you want to identify the cause of that adverse event. So root cause, when we say root cause, what is it? So a root cause is a fundamental underlying reason an event or problem occurred. You are looking at the basis. What is the fundamental reason for which a particular event has occurred? And that is the root cause of the problem. So it is a cause that, if eliminated, prevents recurrence of the problem. Root cause analysis focuses on preventing recurrence rather than placing blame. We've talked about the issue of putting blame on workers. You know, it will not even help them report errors in the first place. So root cause analysis focuses on preventing recurrence rather than placing blame on people. And then it's used widely. It is used widely in healthcare to improve quality and safety. Let's look at some characteristics of finding the root cause. So it's usually a system related rather than individual related. So it's about the whole system, putting in structures so that when there is any adverse event, we will try to find what they cause it. It's just like looking for diagnosis. Until you are able to diagnose what the problem is, you know, what kind of condition a patient had, you will not be able to prescribe, give the correct medication for it. So root cause analysis also applies in that sense. So it's usually a system related rather than individual related. And it's identified through deep analysis. You'll be asking a lot of questions. We call it the 5 whys. You say, but why? What is the problem? What caused this? And then you ask why again until you find the root cause. And we use some methods which we'll talk about. One of them is called the fishbone analysis. It helps you to identify what the cause of a particular problem is. So there is typically one root cause, but some events may have more than one. So for example, a vaccine cold chain failure occurred because the facility lacks a standard procedure for monitoring and documenting refrigerator temperature. So you have a cold chain failure. Once we are talking about cold chain, you are looking at maintaining the temperature in the vaccines. And at the facility level, they're supposed to check the temperature of or monitor the temperature of the vaccines, morning, evening. They have to log. So if a cold chain failure has occurred because the facility lack a standard procedure for monitoring and documenting refrigerator temperature, you can actually do a root cause analysis on this to find out why what happened. And eliminating the gap, we manage to find the root cause. If you eliminate the gap, then you prevent future failures. Apart from finding the root cause, there's also something we call critical cause. So apart from finding the root cause, you also find critical cause. And the critical cause here is a key contributing factor that significantly influences the occurrence or the severity of the event, but it's not the deepest underlying cause. So it's also one of the contributors. Okay, if you have like a problem tree, you want to look at the different causes of the problem. Each of them is a contributing factor. But when you're talking about critical cause now, it's one that kind of significantly influences whatever you want to measure. So critical cause is a strong contributor to the problem, and often several critical causes are identified during analysis. So for example, the staff member forgot to check the refrigerator temperature on a weekend, like the example I gave. So on a weekend, I told you that as part of the cold chain logistic management, the temperature of the vaccines will have to be checked morning, evening, even including weekends. So the staff member forgot to check the refrigerator temperature on the weekend. This contributed significantly, but it is not the root cause. So we are looking at trying to differentiate between root cause and then critical cause. Okay, so the system lacks a weekend monitoring protocol. So it means that the weekdays there wasn't a problem, but this is particularly for the weekend. So it means that, weekends, probably the officer in charge might not be available at all the weekends. So there has to be a protocol for monitoring the temperature of the vaccines at the weekends. Why do we conduct them? Why is root cause analysis important? One is to improve the system performance. We want to prevent future errors and adverse events, because anytime an adverse event occurred, yesterday I mentioned, adverse events following immunization. When you have administered either drugs, either vaccines, the unpleasant side effects, that could happen. And when those things happen, it is always important for us to find the cause, so that in the future we can prevent some of this. So to identify gaps in the processes, in our communication, and the policies, and then to support a culture of safety and continuous improvement. There are different types of causes, that you can look for when you are talking about root cause analysis. We have the primary root cause. We have the contributing factors. When I mentioned the critical cause, I mentioned that the critical cause is one of the contributing factors, but that is not the main root cause. Okay, sometimes the root cause of a problem can be due to human factors. Okay, something from the human side that didn't go well, and that we can use root cause analysis to find that. There could also be system failures that probably resulted in a certain problem, for which you may want to use root cause analysis to find that problem and address it. So let's look at the steps in conducting root cause analysis. First of all, you need to define the problem. What is the problem? Or what is the event that you want to analyze and find the root cause. So this is just like we conduct research. Okay, so you collect data on it and then you gather the evidence. You can even map the event, on the map. Let's show where the problem is, where is the problem more pronounced, or in terms of the burden, how big it is. Then identify the different contributing and the root causes. So the possible causes of this problem, you identify several of them before you finally identify which one is a root cause. Then develop recommendations. So this is just like a research. Once you have been able to identify what the contributing factors are and the root causes, then you have to develop recommendations, for the future, and then implement and monitor the interventions that you have recommended. There are key tools we use in root cause analysis. The first one is 5 why. So you ask why. Why did this happen? You try to find the cause. When you find that one, that may not be the root cause. So you ask another why again until you get the answer you are looking for. Another tool we use in root cause analysis is the fishbone analysis. We also call it Ishikawa. Ishikawa diagram. And this is a diagram that looks like fish, but you are using it to point out the main problem that could lead to, or the main causes that could lead to a particular problem. Then there's also the problem tree. There's also the problem tree that can be used. It's also one of the tools in root cause analysis, or the process flow mapping and the failure mode and effect analysis. These are different tools that can be used in performing a root cause analysis. Let's look at the 5 whys, which is one of the tools, the key tools in assessing root cause analysis. So this one, I said, is a simple method for drilling down to the root cause. So you ask why repeatedly until the underlying issue is identified. And this helps to avoid superficial conclusions. You just don't want to ask the first why and you think you found the answer. You have to make sure that the conclusion are not just superficial. You have really drilled down to find the actual cause of the problem. So now the fishbone analysis I mentioned is also one of the fishbone diagram. I said it's also one of the tools that we use. So it's a visual display. So it's a visual tool for categorizing causes. So common categories here, it can be with the people, whether the cause is with people or it's with the processes or the equipment that you are using, or whether the problem is coming from the environment in which we operate or the policies that guides what we are doing. So you can actually have, when you are using the fishbone diagram, to do a root cause analysis. It helps the team members to brainstorm and look at what the contributing factors are. And then it will help or lead you to find the root cause of the problem. Now, let's look at the role of public health officers in root cause analysis. So they lead or they participate in root cause analysis teams. They collect and analyze epidemiological data. They identify system level gaps affecting health outcomes. And then, of course, they recommend corrective and preventive actions. They also train and promote a safety culture. We've been talking a lot about safety culture. Public health contributions to root cause analysis, so surveillance and early detection of adverse events. We can use root cause analysis to find some of these adverse events that have happened as a result of surveillance and early case detection activities. Risk communication and coordination. If there's a problem and it has to do with the communication gap or a coordination gap, we can actually use a root cause analysis to find the cause. It's also used for policy review and for advocacy, and then monitoring and evaluation of implemented solutions. I want us to look at an example of root cause analysis and public health. So if you want to look at outbreak investigation, for instance, which has helped to reveal breakdowns or some gaps in the kind of processes that we are involved in. Cold chain failure affecting vaccine potency. We can actually use root cause analysis in investigating this. Or there is delayed reporting of notifiable diseases. There are diseases that once you detect it within 24 hours, they have to be reported to the next level. So if there is a delay in reporting, probably from a particular facility, we can, or maybe in a whole district, we can actually use root cause analysis to investigate and find the root cause. And of course, if you have been able to do the root cause analysis, there's always the need to make recommendations. And the recommendations, just like you have your research objectives, recommendations, they should always be smart. It should be something that can be done. And then it should address the system level root causes. And it must have designated responsibilities and the timelines, the people that are supposed to do them, and the different timelines. So I want us to use an example of a root cause analysis that was done on low usage of surveillance data in Obuasi Municipal. This was in 2019. So they realized that surveillance data has to be used for decisions, even for allocating resources and all that. And so if you are not using the data to make decisions to influence policy, then there is a problem. So they use this looked at root cause analysis, want to find out why there is low usage of surveillance data in this district. So I'll walk you through that so that can give you an example if you want to also do or conduct a root cause analysis using any named problem, the best way to go about it. So fine, this is just like a research. So you have a background of what you want to do. Low usage of surveillance data. So first of all, you look at public health surveillance, which always look at data collection, analyzing the data, interpreting the data, communicating it, and using it to take action, and then facilitating prevention and control. This is actually like the background, the main aim of public health surveillance. And so if you are not getting the data, we are not analyzing it, we are not interpreting it and using it for action, then there is a problem, which is why we want to find the root cause. So the objective here is to identify the reasons why the surveillance data are not being used, and then to determine the critical cause. So we are also finding the root cause and then the critical cause. So this is the method session. I told you that root cause analysis is more of a research. So the same way you have your research with your background, with your methods, with your results. So this was, they gathered this data from 1st of March to May. And of course, if you want to find the root cause of why a district is not using the data for decision making, you have to conduct some interviews. You will need to talk to people. So there was a brainstorming session with the health facility staff, and then the fishbone analysis tool was used, and the result was presented as fishbone diagram. So we'll get to know the things I'm talking about. So this is the result presented. And you can see that the head of the fish, if you look towards my right, okay, you say low usage of surveillance data. This is the problem that we wanted to find the root cause. And so this low usage of data, look at the administration. So from the administrative aspect, what could be the problem? So they realize that the administrative aspect, there is inadequate monitoring. Inadequate monitoring. If you don't monitor the people, you don't give them the indicators. Inadequate supervision, you don't give them the indicators so that they know what to do. This could be the problem. Then inadequate computers and accessories. So you can see the different causes. Inadequate computers and accessories, even logistics, inadequate stationery. So they are not able to even print the 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 forms, the surveillance forms to get the data. And so if the data is not reliable, how do you use it for decision making? In terms of staff, they also reported of high workload, inadequate supervision. So some of these things got themselves repeated. So from that fishbone diagram, we identify these root causes. That is inadequate staff motivation. So the staff think they are not motivated to do what is expected of them. Inadequate computers and accessories, high workload, inadequate and supportive supervision, inadequate supportive supervision, and then inadequate technical skills. So these were the root causes identified as contributing to the low usage of surveillance data. And then what will be the critical cause? So the critical cause here is inadequate technical supportive visits to health facilities. So it means that it is being done, but it's not enough. So they concluded that low surveillance data usage in the municipalities is attributed to inadequate technical support visits. So they identify what the critical source, that is the main contributing factor, is because of inadequate technical support visits. It means that the facilities at the peripheral level needs the support to be able to put the data into good use. There was also this challenge of the private facilities unable to budget for data management and high surveillance officers attrition. So surveillance officer that probably is trained, on data management and everything, gets transferred and the new person comes in. And by the time that person is also well trained to do the work, the person is also transferred and then new. So high attrition rates was also found as one of the challenges. Then there was a recommendation to conduct two, and the recommendations will always have to be targeted. So this was recommended that the municipal health management team should conduct monthly supportive supervision to all facilities, and then formulation of task shifting policy in all facilities. These are some of the recommendations. And then public health, the kind of action that should be taken to remedy the situations. All health facilities should receive surveillance reporting formats. So they don't have the forms. They said they reported of inadequate stationery. So if all of them can receive the reporting forms, that means they can report. Then also they need to train the service providers on data management, since there was a gap found in that area. So promoting a culture of safety. This is summarizing what we've been talking about and the role of public health officers when it comes to root cause analysis. So first of all, we have to encourage reporting without fear or blame. It is actually when these problems are reported that we can take the necessary step to say, let's do the investigation using the root cause analysis so we can find the problem, what is causing this problem. So we should encourage reporting without fear of blame. Then we need to use the root cause analysis as a learning tool to find the root causes of the problem. Then ensure transparency and accountability, strengthen systems to be able to protect both the health workers and communities. So in conclusion, root cause analysis improves public health systems. Public health officers play a key leadership role when it comes to root cause analysis. If the data we collect, is correct, people are not afraid to report errors, then we can actually use root cause analysis to find these problems, and we can make recommendations that will prevent subsequent recurrence. We need to adopt root cause analysis to support continuous improvements and safety in our organization or in the health system. I will pause here for questions. This is quite a short one, but it's believed that if you follow through this, you should be able to take any name problem and be able to conduct a root cause analysis. I'm ready and open for questions. Thank you so much for your attention.
Thank you so much. I think this has been a very, very wonderful session. Please, if you have any question, you can unmute and speak.
Is there any question?
Yeah, Doc, please, I want to ask a question.
Mm-hmm.
Yeah, please, I want to find out during AFI investigation, normally we use checklist. So in this case, can we use the two at the same time, or we have to update the checklist we are using?
Okay. And is the checklist such that it will help you find the cause of the problem?
Yes, please.
So once it has captured those, then you don't need to have like another checklist to
Okay.
do that. The essence is to be able to find what actually caused the problem. You want to put in remedial action so that something doesn't happen again. So if the tools you have are able to help you find the cause, and sometimes you can trace some of these things as a result of somebody who may not, who was or is not using probably the proper techniques in injection. There are people who give BCG and people, I say BCG, they who give a penta on their thigh, and children are often having abscesses. Meanwhile, when they receive it from other places, they don't get that. So once the tools are structured such that we'll be able to find what is the main cause. Is it that the person will require training? Is it the technique that has not been applied well? So once the checklist is able to help us find the root cause, and then we can put in strategies to prevent subsequent occurrence, then we are okay.
Thank you.
You're welcome.
So, Doc, I also have a question.
Okay.
We talked about root cause analysis. So, we want to know what are the ethical implications of root cause analysis when failures is coming from human error within the public health workforce.
Okay. Yeah, so the ethical implications of root cause analysis when it comes to human errors. Okay, so I think if you followed yesterday's lecture, I mentioned issues of ethics. I mean, before you even perform a task, I mentioned yesterday how we need to make sure that we even take consent. You want to perform surgery, you want to perform a procedure for a patient, you need the families, you need the family head, you need those who matter to append signature. Until that is now, you don't even have the right to perform the operation in the first place. I mentioned our ethical issues about confidentiality. Okay, making sure that if the person says you have identified the person has HIV, the person say, I don't want my spouse to know. I don't want anyone in my family member to know. You have to respect the person's right. So those are ethical issues. When it comes to errors, human errors in this area, I think we have to separate that also from the ethical issues. The ethical issues is that you have asked for permission before doing what you are doing. But whilst you are doing whichever procedure, you ended up hurting the person. Just as recently, I mentioned how somebody went to deliver. Actually, they had a CS, and the gynecologist who did the operation ended up, having a deep cut on the head of the child, and the family sued the person. So this one, I don't think the person didn't take all the precautions when it comes to ethics. But this one, it was probably, is it also the negligence on his part? Is it something that didn't work well that caused this problem? So most of the time, we need to find, anytime there's a problem of that nature, we need to find what is why should this happen? Is this doctor not trained to do this? Is there a fault with the equipment they use? It could be something about the system. It could be something about the people that have not been trained. It could be some equipment. And so the root cause analysis will help you identify. So it's quite a broad area that can be applied to a number of things. And we are not just doing root cause analysis. It's because we don't want such a problem to occur. Otherwise, every now and then, we'll get the members of our team, having to go to court from one case to the other. And we don't want that to happen, because we are not there to cause harm to people, but to save lives. So root cause analysis is very important. And of course, we need to make sure that we apply the ethical rules, getting the people consent for whatever we are doing and all that. Yeah. I don't know. I think I said quite a lot. I don't know if I've answered you.
Yeah, you've answered perfectly. Thank you so much for that detailed answers. Please, we still have about 20 minutes more. if you have any question, this is the best time to ask Dr. Mavis. So I'll give a little bit of 1 minute. If you don't have anything, we shall end the call. Okay, so thank you all for joining today's session. And I believe that you have learned a lot. We have learned a lot from Dr. Mavis. So far, all of the sessions are recorded, as you know, and we would be uploading them on our YouTube channel once all of the trainings are done. So thank you so much for joining again. Bye-bye, everybody.
Bye.
Bye, Dr. Mavis. We are very, very grateful for your wonderful sessions. We'll share the YouTube videos with you as well once it's uploaded.
Okay, thank you.
You're welcome. Bye.
Bye.